Hi, welcome to My Favorite Mistake. I'm your host, Mark Graban. Our guest today is Michelle Rankine. She is a trailblazing entrepreneur in the health space who has leveraged a multi-million-dollar franchise business to address the health disparities and needs of those within minority communities. A former sports executive turned entrepreneur, Michelle opened her home care business after her brother's tragic car accident that left him paralyzed, and is today the owner of 3 franchises of the Right at Home, an in-care business that helps bridge the care gap and solve health disparities and inequities within Black and Brown communities. So her franchise locations have generated several $1,000,000 in profit to date from her efforts toward prioritizing aging adults in minority communities. So with that, Michelle, welcome to the podcast. How are you?
I'm good. I'm so happy to be here. Thank you for having me.
Yeah, it's great to have you here. I don't have this in my notes. I know you have a PhD, and that degree is in
Yes.
which field?
Oh, my PhD is in education.
Okay, but your career, maybe this will be part of your favorite mistakes story. I don't want to get too ahead of things of career twists or turns, perhaps. But we'll jump right into things, Michelle. What would you say is your favorite mistake?
When asked that question, it really makes you think like, whoa, what was my favorite mistake and where was that lesson learned? And there was a lot of different ones, but I think for me right now with the shift from actually like what you're leading into, from the shift from the collegiate world into being an entrepreneur, there's one overarching theme and it's called trust.
Hmm.
And trust not only in yourself as an entrepreneur. When I worked in higher education and I worked in sports, I was part of a bigger system that had all the framework already established.
Mm.
And so when you're starting something brand new at an entrepreneur, you have to create those systems,
Uh,
right?
mhm. Yeah, yeah.
And so with creating those systems, I really learned that, okay, I need to one, trust myself, and I cannot be the expert in IT,
Mm-hmm.
in care management. That wasn't not my field of expertise. And really and truly having an implementer in my office to really to carry out the ideas that I had. And so for me specifically, there's one specific story that speaks to it is
Hmm.
I took the role in my business 11 years ago to be the salesperson. I said, as I was building my structure, I said, okay, Michelle, you're going to designate sales as your primary.
Hmm.
I oversee everything else, but sales is going to be my baby.
Hmm.
And so I really thought, especially as an entrepreneur, that I needed to be the face, especially starting out, to build my brand the way I wanted to, and also kind of have that face recognition in the community because our business in senior care, we help everyone, not only brown and black communities, but for all people within my territory, which is Collin, Denton, and Tarrant County within the DFW Metroplex.
Hmm.
And with that, I said, okay, I have to go out and really knock on these doors and build these relationships and tell people in the community my why.
Hmm.
And my why was really my brother's story. I
Yeah.
really wanted to get it out there to others that, this is a service out there. I think a lot of people don't realize it because it is something innate. Like, when you have a family member that goes to the hospital, everyone kind of chips in and figures it out as a family. And we really don't realize that there's this resource out
Hmm.
here. And so during that period of time when sales really became my baby, and I had to now really focus on my business and not in my business,
Mm.
I had a struggle. I had an extreme struggle with letting it go and saying, you know what, I'm going to hire other professionals with the same like minded values as I do
Hmm.
and let them lead the charge of this business so I can really work on it. And
Yeah.
so that was my favorite lesson thus far is that I cannot do it myself and I need to
Yeah.
leverage that trust to others.
Yeah. Yeah. How, and I mean, was it a gradual recognition of that? Was there kind of a specific moment that was a wake up call for you, Michelle?
Yeah, it was two things. I think everything in your business has to be measured, right?
Hmm.
And I noticed the business plateaued, right? There was only so far I could take my business. And so I realized, you know what, Michelle? The numbers are speaking to it, the data is speaking to it. It's time to make the change. Even though innately in my gut I felt it coming, I just wasn't ready until I saw the numbers right in my face and saying, okay, now it's time to
Mm-hmm.
make the change.
Mm-hmm.
So it was that for me, because I said, all right, now I need to really make the shift. I made the shift in other departments because I felt that, okay, I am not that expertise. I'm going to have them own that department. But for the sales, I said, okay, yeah, this is the time when the data spoke to it. And then really and truly, that's when I really saw the gradual growth. And you just have to really trust others. And, with building your business, especially with like sales in that department, it's building those KPIs and structures. And for me, I love the saying, trust but verify, right?
Mm-hmm.
And
Yeah.
so it's really, trusting myself, trusting others, and trusting the KPIs and the data
Mm-hmm.
that shows their work.
Yeah. What were some of those key KPIs that you were noticing or paying attention to?
So in our business, one of the key performance indicators for us is really our hours served. We want to really make sure we're reaching our goal metrics of hours served per person. And so for that, that's really my key KPI, as well as we do surveys and really using the measure of how our employee experiences as well as our client experience, because we not only want to make sure we're reaching these hours, but we have to make sure we're reaching quality as well. So
Mhm.
those are the top 3 KPIs.
Yeah. And I mean, it's so important to talk about extending, trust, letting people do their job after they've been, brought into a team, or like you said, finding that fit on values and purpose, and then you can teach them, procedures and policies on top of that. Um, as part of that recognition, I'm curious, did any employees give you any feedback and say, like, Michelle, I don't know if there was any micromanaging was going on, or did anyone say, Michelle, just let us fly,
You
we
know,
got this?
yeah, there does come that piece with it. I think the initial stage there was a level of micromanagement because it
Hmm.
had become my baby,
Hmm.
and I think the other piece is, especially when you hold a project and you own a project, and when it's actually sales and it's your face, it's these relationships. I think also the challenge with my sales directors that came in place after me, it was like, I'm not Michelle, but let me tell you who I am. And
Hmm.
so that was a challenge at first because they were still wanting to contact me. And
Hmm.
I had to leverage this relationship with the new party. And so that was a level of challenge in sales because it's not my face, it's not my relationship. So now they have to foster these new relationships. So I think that piece, one of the key things that I learned in it is that I had to create good communication, good handoff, good collaboration, and creating the environment
Hmm.
that they feel comfortable to say, hey, Michelle, I'm having a challenge with this referral source. It used to be our top one, your top. So now how can we team up to make sure that they connect, that I am still with you?
Hmm.
And so I think sometimes that can be a challenge in sales going forward, but I think that was just the empowerment piece for me to empower my people to say, okay,
Yeah.
this is now your relationship.
Yeah. And it sounds like with that focus on key performance indicators, if you had any uncertainty about this new approach, it sounds like you got some reinforcement that,
Yes.
yeah, this is better for the business. So happy to
Yes.
hear that, right?
Yes. You have to have it.
Hmm.
What doesn't get measured doesn't get verified. And,
Yeah.
and you have to measure everything.
So I think, maybe you would step back a little bit, an opportunity for you to educate, if the listener isn't real familiar with home healthcare services. There's the scenario, with your brother being paralyzed, and one can only imagine, the type of assistance somebody would need. But, what are the most common situations or types of at-home healthcare that people would need and hire a company like yours to provide?
Sure. I think one of the major things that we help with is specifically dementia, Alzheimer's, Parkinson's, and post surgery.
Hmm.
I think the most common thing right now is helping our baby boomers. My
Hmm.
brother was an anomaly in the sense of an accident for someone young. That is
Hmm.
probably the least people that we serve. But our senior population and our baby boomers is who we predominantly serve. And with those disease processes that really limit mobility, cognitive abilities, where we really want to keep them safe, is where we find that we really have the need, and where we fill in the gaps for families.
Mm-hmm.
And
Oh, go ahead.
no, sorry. And for those that don't understand home care gets lumped into like a whole lot of different elements,
Mm-hmm.
right? There's home health that sometimes we're used under that umbrella.
Mm-hmm.
And many persons think that it's paid by their health insurance. And so that's always like a misunderstanding when for what we do in the home, we're there for long periods of
Mm-hmm.
time. We're not paid by insurance, it's private pay. So when you think of actually activities of daily living, getting someone up in the morning, helping them with their breakfast, cooking for them, dealing with incontinent care, getting them a bath, and really just making everything that a loved one would do for them. That's what our caregivers do. That is not paid by your Medicare,
Yeah.
Cigna, Humana. However, with home health on the other side, that is a more skilled need, and you require an order from your physician. This does not require an order from your
Ah,
physician.
so
And
so
so that's that key difference.
so I made a mistake in conflating a
Mhm.
little bit home care with home health care.
Yeah.
You made that difference more clear.
Yes.
Well, I'm not look, and I'm not one to edit out mistakes. I learned something, and I'm just thank you.
Hey, that's the whole topic of the show. We're learning.
So
We're learning.
thank you for clarifying that. And I mean, it sounds like in a lot of cases, the home care could help people either avoid or delay a more expensive option like memory care or nursing home or extended hospitalization. Is that fair to say?
Yeah, I mean, our biggest goal is to keep a person out the hospital. And really and truly, when you look at the healthcare system, keeping persons out the hospital will lower the cost of what we're paying right now. It's because of miseducation, not being able to understand your medications, or not being able to understand like your discharge process when you get home, that really leads to a level of uncertainty, and people just dial 911.
Mm-hmm.
And that happens a lot with our seniors, especially those that live alone. It's high anxiety. You may have someone who has COPD and has breathing issues, and they're really their cord could have a box on it, and
Mm-hmm.
that's why they're not getting the enough air that they need. And so having that extra assistance, extra eye at home, really makes a big difference to what would they call in healthcare RTAs, which is return to acute. You
Mm-hmm.
don't want persons continually going back, because there's also other elements that happen with that. Then, more prone to pneumonia, more prone to other disease processes that you may get being in the hospital, right? And so we really want to keep people at home. I think coming out of post COVID right now, we all know home is really where you will get the best care.
Mm-hmm.
And, we exactly like you mentioned, we want to delay, going to a nursing home when you can't control it at home, or in memory care because of elopement issues.
Mm-hmm.
We really want to make sure we can keep people as independent and as long as we can.
Yeah. Yeah. And so with your business, with your franchise right at home, is there that full spectrum that you provide, or do you partner with home health in that level of care?
So yeah, we partner with every entity
Okay.
along the way. That's one thing I love about what we do, is because we're private pay, there is no limitation. So if you have a family member that's in the hospital, for example, a patient with dementia gets hospitalized, many times they don't understand what's really happening, right?
Mm-hmm.
And so they have IVs, they may want to pull it out.
Mm-hmm.
We can follow the patient every part of the spectrum. So from the hospital to a rehab, to an LTAC, a higher acuity. We can take them all the way when they come home with the home health, and even with hospice. Because hospice, when you reach that end of life care, they are not with you around the clock.
Mm-hmm.
They're not able to assist. And when families are charged with that end of life financial planning and end of life next steps, it's very stressful. And sometimes, you have so much other things that have to be planned. You really need someone bedside to handhold and kind of assist the patient and making sure they're passing with dignity.
Yeah. Yeah. And that's a challenging situation for family involved, or the family isn't able to provide that support themselves, or to have help and getting through difficult times. I mean, how much of, I mean, is maybe a different partnership, people who need emotional support, counseling for getting through that difficult time of a loved one's life.
So that's where we lean on our partners.
Yeah.
So, especially when we have a patient that is with hospice, hospice handles that piece. That is part of what you pay into,
Mm-hmm.
your death benefit, right?
Mm-hmm.
When you have that hospice benefit, they have a social worker that's going to assist you. They offer grief counseling. So the hospice really comes into that role. When you're really needing that extra assistance, especially not only for the loved one, but the family themselves.
Yeah.
And that actually continues even years after the loved one passes.
Mm-hmm. So I'd like to take a bit of a detour, if we can. I want to come back, and there's other questions to talk about. I think related to home care, but the one part of your bio and seeing your
Mhm.
LinkedIn profile that jumps out was your time in sports management. Seeing
Mhm.
roles with even professional sports teams, the U.S. Olympic Committee.
Mhm.
Could you talk a little bit? I'm just curious to hear about
Yeah.
like that career direction and the things that you were pursuing in sports. Someone
Oh, yeah.
asking mainly as a sports fan who's interested in sports business.
I know. You know what's so funny? I can't not see this Northwestern hat that you have on. These Wildcats. As a Purdue alumni,
Uh,
I have a little hesitation, but it's still Big Ten, so I'll cheer it on, right?
yeah, yeah. Purdue's won the last couple of football games. We've surprised Purdue in men's basketball
Yeah, that
a
is true.
couple of times, but yeah, it's a pretty our schools aren't that far apart.
Sports is my love, and
Mhm.
I've always loved sports. I grew up in a sports household. I ran track for a very long time, and so for me, with making the change, sometimes it doesn't seem like the right trajectory, but it does
Mhm.
in many ways because. With my love for sports, especially anyone who is seeking to work in sports management, it requires a lot of volunteering.
Mhm.
And a lot of people don't know that. I volunteered with the Big Ten Conference, the NCAA. You're volunteering at meets. You really have to put your time in
Mhm.
and really show your worth as you're going through that. So I did that throughout my collegiate years and further interned post college with the New York Jets. And
Mhm.
then when I was doing my PhD, I did two specific things that were really important to me. I worked with Nike with the Jordan Fundamentals Grant, and then I landed a position with the United States Olympic Committee. But in that journey, it was actually like coincided with what I was into at that time. So, like in undergrad, it was about statistics. Well, I was doing sports statistics at basketball games, making sure that everyone had, the listing of how many shots were given, giving it to the media, making sure all the media was taken care of, make sure they had all the right information for their articles. So it was a media focus for undergrad.
Mhm.
My master's was more management and operations focused. And then when I was doing my PhD, it was all about educating athletes and making sure athletes have the resources, and most specifically at the USOC, United States Olympic Committee, was really creating programs for the grassroots efforts and pipeline for sport.
Mhm.
And I think when you think about, okay, yeah, when you look at United States and you look at just coming out of the Olympics most recently, and we look, how do we get so many athletes in track? How do we get so many great gymnasts?
Mhm.
That is started from grassroots efforts that were initiated 10 years ago
Mhm.
and really building the systems and process of getting coaches at that level to
Mhm.
always empower and build the pipeline for the sport. Because as we know, to become an Olympic athlete or a professional athlete, it is one out of many.
Mhm. Yeah.
It's not an easy task, and it really requires a lot of planning and a lot of grassroots efforts in regards to building grants. And so
Hmm.
that's how I helped along in my PhD journey when I worked with the USOC. But it's funny, all three of those elements have been crucial to my entrepreneurship journey
Hmm.
because now the marketing PR that I had from sports is very applicable to this.
Hmm.
And then when I look at the organizational and creating teams and then grants, like it is completely transferable into healthcare right now,
Hmm.
and more so to the resilience.
Yeah.
When you are an athlete or working with athletes, you have to be resilient. And I think one of the key factors that I've noticed that helped me along the way and really speaks to sports is when I used to do stats at a basketball game. You could be at the Big Ten tournament. People are shouting, okay?
Hmm.
Everyone's cheering for your team. The cheerleaders are on here, they're dancing, and you have to be laser focused
Hmm.
on what you're working on right now and blocking out the noise. And that for me is one thing I think for sports and carrying over into entrepreneurship. You have to be able to block out the noise and focus
Hmm.
on your target at hand.
Hmm.
And when you're an entrepreneur, there's a lot of noise, right?
Hmm.
You could have complaints. You could be dealing with issues in the office or like morale and trying to get everyone together. You have to fix and pick your focus
Ah,
and
yes.
really block out the noise. So I don't know how if I answered your question,
No, you
but
did. Yeah. Yeah. Uh,
sports is fun, but it has so many elements, and that's how I got it to here.
yeah. No, I love what you're saying about having the block out noise because, I'm in a work from home mode today.
Mhm.
Partly explains the hat. I didn't give too much thought to the hat, but I had it handy and it's football season and I put it on. But, um, coming into like even in the last 30 minutes before, coming into to do this podcast interview, there was a lot of noise kind of going on, both professionally and I'm on an HOA board and there are things that pop up that I was doing my best in the last couple of minutes before we recorded to say, I'm going to put my phone on do not disturb. Like
Right.
everything else can wait, but that's something I've had to try to get better at as an adult. So I'm going to take what you said as encouragement and a reminder to block out the noise, to be in the zone, which I like to think I'm doing okay with here in the moment. But I also I wanted to ask you a kind of follow up question around thinking how much are there programs to provide equal opportunity and equal access for young athletes. You think of some sports where you'd like to think if you're fast the world will discover that and there's a path to the Olympics. It's probably not that easy. I'm sure gymnastics has huge barriers in terms of coaching costs, gym costs. I'm curious. Was there? Did you have? It sounded like you were talking about programs that might have been focused and sort of just bringing more kids
Mhm.
into that pool of potential Olympians.
Yeah, so what they had at the USOC is that there would be grants that coaches could apply for to have more access and
Hmm.
give more access to the sport. It doesn't all the way give it directly in the sense to this person now will have full access to the gym, like for
Hmm.
example with gymnastics and that such, but there is opportunity for coaches to apply for different grants that can increase their access in their gyms.
Hmm. And I think we see for I'm sure for a multitude of reasons, including somebody always goes first. 2024 Olympics in previous years, women's gymnastics so
Mhm.
popular, and those teams are so incredibly diverse compared to decades ago.
Right.
And I think that represents America and trying to compete on the world stage with the best of all our people.
Yeah, I love that. I love that. And that speaks to those grassroots efforts, right?
Hmm.
You have to really not only have inclusivity in regards to training and knowing how to work with diverse groups, but also just giving access. If you give access, we will break every ceiling, right?
Hmm.
And so it's really just finding those communities and really giving them the access and the tools. And I think that's the biggest thing and the biggest challenge we have to face for sports, education, everything is like we just need equal access.
Yeah. Um, you also mentioned resilience as an athlete. I've enjoyed episodes I've done in this podcast series with former pro athletes who are often faced with the situation of making a mistake that is very, very public, either for all the
Mhm.
people watching in the stands or people watching on TV, having to bounce back for the next play, the next race, the next game. Do you have any experiences as a track athlete where you would say you made a mistake that you had to bounce back from, or a
Mm.
mistake you feared?
Oh
Or,
my gosh. Thinking back, I'm showing my age now, right? Um, oh, gosh, there were many mistakes. I think the first thing that comes to mind was from a very long time ago. When I think of mistakes and when we're talking about the subject of trust and self, right? I remember the first time I learned how to hurdle.
Mhm.
And for me, you never want to fall. Like the number one goal is just not to fall.
Don't trip
And
on the
don't
hurdle.
trip, don't fall. And
Yeah.
I remember when I first learned, my coach said to me, he was like, "You got this." I never fell in any of the practices, and he's like, "Okay, now I'm at the first meet." And when I fell hard. It was
Mhm.
an epic fall,
Yeah.
and I was like, "I don't want to do this anymore."
Mm.
And he was like, every hurdler falls, right?
Yeah.
Everyone has to fall, Michelle. And I think for me, that like the first memory that came to mind was the first fall.
Mhm.
Because I don't remember any of the falls thereafter, but I
Mm.
remembered the
Mhm.
first one because now I had to make the decision to trust myself and do it now,
Yeah.
right? And really build myself up. And I think sometimes in sports or
Mm.
life period, when you fail that first time, it hurts.
Mhm.
But what you realize from that first failure is that this is all part of the game, right? It's those wins and those losses. And so I'm just trying to increase my win ratio versus my loss ratio, right?
Yeah.
But it's that first failure that sometimes hits you in the gut, and then you
Mm.
have to pick it up. And when we're talking about gymnastics and like a public thing, I think that can be hard, right? You're all the people are in the stands and everyone's singing, and when I ran track, we didn't have social media,
Yeah.
right? It's not plastered on the internet for everyone to see
Right.
continuously. So that is a different element that I think today I can't speak for, but I feel that these athletes now, when we talk
Mhm.
about being laser focused and not focusing on the noise,
Mhm.
you have to be even more intentional about what you listen to and the thing your personal
Mhm.
thoughts. And I think when you're going through sports psychology, you have to find your flow, right?
Mhm.
And that's with everything. When you're in your flow, you're in your element.
Yeah.
And that moment when you're there, even when you fail, how do you fail out of it?
Mhm.
And how do you perfect it going forward? And
Mm.
I think that is the big thing with trust and trust
Yeah.
with self.
Yeah. And thinking of your story with the hurdles, it's so great that you had a coach right there to help you pick yourself up, dust yourself off, encourage you. I mean, I I mean, I'm thinking back to, this might have been middle school or high school gym class. I'm trying to think when I, would have been given this opportunity, but I was not a hugely athletic kid. I played baseball. I loved sports, but I had my limitations, and never been a runner. And I think, boy, being given this opportunity of like looking at that hurdle, and I'm sure my reaction was just like, nope, that, that no, thank you.
Not today.
That's not, maybe never. That doesn't, not for me. I couldn't even see myself doing it. And I don't remember if I had to try, or, but I was sort of like, okay, I don't need to do that, but I can only imagine. I mean, yeah, the exhilaration of doing something like that well, which I think is part of the fun of watching the Olympics, and being
Yes.
so amazed by all the things I couldn't even imagine doing. But I mean, if you hit a hurdle, and I mean, do you scrape your knee? Is there? I mean, like, could you break a wrist? I'm just trying to think of like
No, I
the
didn't break any bones. I
yeah.
just, fell in an epic way where I had skid like every part
Oh,
of my arm and knees, and I didn't have any breaks, so that was the blessing in it. But it just was an ugly fall. It didn't look too cute.
but again, thankfully, no one was filming it. It didn't go on
It didn't go viral.
Instagram with hashtag epic fall or
No.
hashtag face plant or
I know it could be one of those, what do they call the memes that boop.
we don't want to be a meme.
No.
So I would love to shift back. I'm glad. Thank you for all your insights there. I'm glad I took that detour, and I'm reminded of college classmates that were high
Mhm.
performers in different sports, and why people with there's so many benefits, mental toughness and resilience that come from people performing at a high level like that. But I want to come back and talk about right at home and business that you're in, and maybe share opportunity for you to share a little bit about health disparities. And
Mhm.
I know your business serves I'm sure all sorts of people in those counties, but with your passion of trying to close different health disparities, there's so much data, there's so much reality of that out there. But
Mhm.
if somebody's unaware of those different disparities, how would you maybe try to summarize that for people?
I think right now, especially in the entity that I'm in, which is home care, when there's such a the financial access is a
Mhm.
barrier, right? I think the biggest thing is educating caregivers, which is huge within social circles of churches. Really empowering and getting to the churches is really the access point, because many people who are needing assistance, especially with seniors, they're going to look to their area of faith.
Mhm.
And so the reason why I say that as the area to give us assistance, because not everyone's going to be able to afford this 24/7. And not everyone has prepared financially with long term care insurance to be able to
Mhm.
leverage that financial need, or they're a veteran. One of the key things that I feel within the church community is that we have to understand respite. And
Mhm.
respite is that break.
Right.
And I think for many people who are caring for a loved one with cancer, a loved one with dementia, it is a constant need. And it's this invisible labor, I like to call it, because
Mhm.
not only are you planning your day, but in your head, you're planning someone else's day constantly. And that is labor intensive on your mind. And for people to be able to shut down and actually have quality sleep.
Mhm.
So, having a good set plan, I think, for educating people to know when to take a break
Mhm.
and that a break is necessary. I think having a home care agency, like for example, us, we don't have any set contract terms. If you need me for 1 day a year, that's all you need me for.
Yeah.
But understanding where your limits and where your breaks are, I think, is going to help, because what ends up happening when caregivers are extremely stressed or under different elements, or putting the wrong people in place that aren't trained, you're seeing higher accounts for elder abuse.
Mhm.
And
Mhm.
those are the things we really want to avoid. We want to make sure that people are taking the adequate breaks and that people have access to the resources. So, not only the churches, but the different disease processes. Alzheimer's Association has huge amount of resources, as well as Parkinson's. Really looking out into those resources. United Way, in Texas, where I am,
Mhm.
there's a agency, and usually it's around the states under different taglines. But for us, it's called Area Agency on Aging, AAA. Not the one who comes and fix your car when you have a flat.
Yeah.
But Area Agency on Aging is a great resource, and which can really help with the financial gaps that can happen and accessing grants. as well as just giving the education and the resources that you need. And I want to come back to the churches, because the churches are a great foundation, because a lot of them will have senior health expos and educational seminars that really speak to what's happening in the local community. Texas is highly underfunded when it comes to senior care. But
Hmm.
when I talk with other owners in other states, there are other resources that are out there. So I really think that with one of the charges that I have, that especially for everyone in my office and myself, is that we really have to make sure we're spending a lot of time and giving the resources to the churches,
Hmm.
because they are the number one outlet to reach the community.
Thanks. And a couple other things, talk about before we wrap up. It seems like even if finances were not a barrier, there might be a mistake that's made of somebody waiting too long to ask for
Yeah.
respite help, or whether it's family or caregivers or the patient. Or, the mistake of waiting too long to bring in or even accept home
Hmm.
health care. I imagine is that part of
Oh,
discussions you're having as part of your sales process, but as a way of helping people get
it's
what they need or could use.
oh yes, it's huge. It's huge. When you look at the ages we're serving, I'm going to use an example like for veterans, right? They are so prideful, so prideful. They don't want to say that, I'm having difficulty when I go to the bathroom and I actually end up on the
Mm,
floor, right?
yeah.
Having that real conversation with your daughter and son, sometimes for many people, they don't want to lose that independence that they have. Because the first thought that many people have is that they think, oh, I'm going to go to the nursing home, so I'm not telling them nothing.
Yeah.
So I'm just going to keep doing this. And what ends up happening is that they have a really, really bad fall. And so, what really has to happen in this process as people are aging is opening that line of communication.
Mm,
I think, with as people age, I know for myself, when you have a challenge, I've had surgery before and I'm like, oh, I think I can lift this. No, 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 I'm not, because I want to try, right? You always want to try. And that's why you have to have, like we talked about earlier, a coach, right?
mhm,
Whether that coach be an actual caregiver that you hire or that family member, you need someone constantly with that person to remind them that you don't have to do this alone and you need to trust others. Kind of
mhm.
circling back to what we talked about,
Yeah.
because you have to trust others in this process. And with everyone, I talked about seniors in regards to how prideful they are, but I think everyone, when it comes to that point of vulnerability, especially when you talk about personal care,
Yeah.
it is a very difficult topic. I'm thinking back to my brother. I remember when my brother, was in the rehab, and he mentioned how all of his friends were seniors,
Yeah.
right? And at
Yeah.
that moment in time, I remember when he mentioned he had an accident, and he didn't want to tell anyone.
Hmm.
And you have to tell someone, right?
Right.
But he was prideful, and this is someone in their 20s, right? And that piece of vulnerability is really that when
Mm,
you really do that inward work, like I can ask for help and
mm,
it's okay to
mm,
ask for help. And I think, in those moments of vulnerability, when we talk about self-care,
mhm.
how will I ask for help? And can I ask for help? And it starts actually from how you do work now,
Mhm.
right? We're talking about being laser focused. When I am in a crisis and I need something, will I always seek to me to solve it, or will I ask the experts? Or
Yeah.
will I go to someone? And I think it starts from the things that we do as a habit day to day. And then when we have that moment of vulnerability, it becomes a habit that you will
Yeah.
ask for help. So it has to start early.
Yeah. And maybe the last thing to talk about here is situations where I think as adult children of adults, we still think to, well, the parent is generally the coach,
Right.
serve that role, and then there gets to be a time where that starts shifting.
Hmm.
And I'm sure in the people you're working with and helping, there's that challenging situation of parents accepting their adult children in that role now. Do you have any kind of, good thoughts or tips about navigating that?
Ooh, that's a hard one because
Yeah.
every family is different and every patient is so different.
Hmm.
But I think the key takeaway, they coin it the sandwich generation, right?
Yeah.
You're caring for your loved one who's older, and you're also caring for your kids, right? And I think one of the hardest challenges, or I would say that probably one of the biggest challenges with that is that line of communication. How was it from in the past, right?
Hmm.
Because I'll tell you, most families that I talk to, or daughters or sons, they're like, oh, I feel so guilty.
Hmm.
And it's this level of guilt and shame to do things behind the parent's back,
Hmm.
right?
Hmm.
Or they feel like, okay, how can I include them? I think starting these conversations early is the best way before an incident
Hmm.
happens,
Hmm.
right? Okay, mom, let me know how do you want this to go? And if she says no, I don't ever want to go to a nursing home, or no, honor their wishes as they see, and involve them in the process. I think that's the
Hmm.
hardest part.
Yeah.
A lot of people don't want to involve them. And I think with involving them, depending on their diagnoses, for example, let's say it's dementia. For many people, the truth is the truth. And I agree, the truth is the truth. But when you're working with someone with dementia, sometimes it's okay to therapeutically lie.
Yeah.
Does that make sense?
Hmm.
So, for example, they may be hesitant. Most people don't want a caregiver coming in the home, period.
Hmm.
But if you framed it in a way that this person is actually just coming here to check the AC unit on a regular basis,
Hmm.
they'll build a familiarity with the
Yeah.
caregiver's not really checking the AC unit, but
Right.
they're
Right.
coming here to maybe just play a game of cards or just
Mm-hmm.
check on you. You kind of have to frame it not as a caregiver,
Hmm.
but actually someone that's coming to check the home.
Sure.
And so sometimes I have to tell families, I'm like, maybe frame it differently
Hmm.
that they would accept it. And sometimes that lie has to be a little bit different depending on what they will accept.
Sure.
I remember one client specifically that was really into cars.
Hmm.
He loved Indy 500. And so she said, if we could just have the caregiver put on an Indy 500 shirt and say that he needs to come check the car on a regular basis, he'll
Hmm.
welcome him in here and say, hey,
Uh,
do you want to have a coffee? And he did. He
yeah.
did. He was like, "Oh, I'll have a coffee with you." He's like, "Do you play cards too?" He's like, "Yeah, I don't have nowhere to go." He's like, "My next client's not till 4." So
Uh,
he sat down and then welcomed him in, and
yeah.
his cognitive abilities were declining. So he didn't remember every time when he came
Mm.
back with that Indy 500
Oh.
shirt. And he said the same thing. He's like, "Do you got 2 hours to come
Uh,
play cards?"
no.
And I mean,
Yeah.
those stories make me cry because it's just
Mhm.
like it's so precious, but you don't have to tell them. It's
Yeah.
therapeutic lying in that sense.
Yeah. Mm. Well, our guest today, Michelle Rankin. Thank you for connecting the dots so well between your story about learning to trust your team, lessons from sports and sports management, and from your business right at home. So I really appreciate you sharing about that. I'll put links to Michelle's profile and to the business if you are there in the DFW area. Especially hope you'll and you think there's a need, reach out to Michelle. So thank you so much. It's been a pleasure talking to
Well,
you
thank
today.
you.
Thank you for letting me put noise out of mostly 95% out of the way to have a great discussion with you here today. Really appreciate you being here.
This was great, Mark. Next time, just a Purdue hat. That would have solved all problems. I really appreciate it.
All
This
right.
was really good.
Thanks.
Thank you.